wonder the whole process that the parents has to go through, where, if they find any differences in the child, the communication lagging or the eye contact or following of command, as you mentioned, and they go to a pediatrician, then they go to a development pediatrician, then they come to you. I'm just imagining how much uh, confusion, how much stress or anxiety parents might be going through. So in your experience, what's the reaction that the parents give, when they come to you?
Many a times, Avisha, I don't want to be the first bearer to say this news to them. I really don't want to be. I need to inform a parent that your child is diagnosed with autism or it's under the spectrum. So I really avoid it. But somehow you have to be frank and somehow you have to be truthful to guide the parents to the new the new aspects, the aspects of therapy. So you have to be straightforward, you need to be truthful. Many parents have come to me saying that we were not informed by the pediatrician, we were not informed by so and so person, we went to this homeopath about the behavior and everything. They did not tell us about it. So then I feel what is happening to our society? Aren't we supposed to inform the parents, tell them if something is there, so the child gets the treatment at the right and the appropriate age? Avisha, in all of these, the intervention is very, very important. So early intervention is the key to all the therapy. So if at all, like as I would say, a parent, when they understand, okay, fine, now the child has a diagnosis along the spectrum, they need to, the denial, the grief, the pain, or the sadness that they go through, and there's sometimes like a big this not happening to me, this is not, this is not what is going on. So this whole thing needs to be taken in, sucked in, and looked into, that I need to work with my child, I need to do therapy with my child, I need to take a proper professional intervention that is very much needed.
Correct. And if they come to acceptance, I'm sure still parents will be, or the extended family members also sometimes, that, they go through a lot of stress in terms of how the schooling is going to happen, how, the child is going to be independent, if at all the skills are lacking in that manner. So how do you intervene with parents and the caregivers around the child?
See, I would say one step at a time.
Okay.
So now just means once they start with the therapy, I keep giving them a weekly report regarding how the speech and the OT is functioning, how the child is doing. As much as possible, once the child is settled in, we make the parents see therapy at least once in a week, so that they start sitting, they start working at home also with these activities, which is very important. So even if you are doing like 1.5 to 2 hours of therapy in the clinic every day, you still go home and you do certain amount of 1 hour or at least minimum 1 hour of therapy twice in a day with the child, so that the child also starts learning with you. So that is one way of doing this. Sometimes it may so happen that the parents do not get the time, or they do not make that much effort, or the child is not ready to learn with them. So do not get discouraged, do not get disheartened. The child might take some time, but once you start, even if you can't do or you don't work well with your children, but dance with them, paint with them, color with them, play work with them, do sand work with them. You don't have to be a therapist to work with your child.
True.
You actually have to give them learning experiences. So even if you play and take a clay and make mango, apple, banana, boat, that's also good enough. That's a sensory experience. That is a proprioceptive experience to the child. It's an auditory experience, visual experience to the child. So you have to work with your children, get down to the childlike level. Your child loves clay. Most of them love clay. Most of them love sand. Most of them love paint work, So they like messing sometimes. They like the messy play. So work with them along with that. So I encourage the parents to play with their children. Before you actually start a therapy. See, they're already doing a certain amount of therapy. The child may not do therapy with you. So, but why don't you at least start, working or getting some learning experiences with your children again. Another
True.
part that I would encourage parents into looking is to having always once in a week or once in 15 days a sit down with their therapist to know what exactly are the goals, and
Correct.
what planning is being done. A proper therapy plan is the key to any plan.